Question 1. A client presents with a localized rash that is red, itchy, and has small blisters on their forearm. They are unsure of the cause but mention it appeared yesterday. What is the most appropriate action for the massage therapist? A. Proceed with the massage, but avoid the affected area. B. Apply a cold compress to the rash and continue with the massage. C. Refer the client to a medical professional and reschedule the massage. D. Apply a topical lotion to the rash before proceeding with the massage. Answer: C. Refer the client to a medical professional and reschedule the massage. This question tests your understanding of absolute contraindications and the importance of recognizing potential infections. A localized rash, especially one with blisters and itching, is a clear sign of an unknown skin condition which could be contagious or irritated by massage. The most appropriate action is to refer the client to a medical professional for diagnosis and to reschedule their massage until the condition is cleared or a physician's note confirms it is safe to proceed. Prioritizing client safety and upholding professional boundaries means never diagnosing or treating conditions outside your scope of practice. When in doubt about a skin condition, always choose to refer and reschedule to protect both the client and yourself. Question 2. Which of the following muscles is primarily responsible for hip flexion? A. Gluteus maximus. B. Hamstrings. C. Quadriceps femoris. D. Iliopsoas. Answer: D. Iliopsoas. This question focuses on fundamental human anatomy, specifically the primary movers for hip flexion. The iliopsoas, comprised of the psoas major and iliacus muscles, is the strongest hip flexor and plays a crucial role in actions like lifting the leg or bending at the waist. While the quadriceps femoris muscles, specifically the rectus femoris, do contribute to hip flexion, the iliopsoas is considered the most powerful primary hip flexor. Understanding key muscle actions helps massage therapists target areas effectively to address client needs, such as tightness from prolonged sitting. Knowing the primary action of muscles like the iliopsoas is essential for effective assessment and treatment planning. Question 3. During a client intake, a client reveals they are taking anticoagulant medication. Which massage modification is most important to consider? A. Avoid deep pressure and vigorous techniques. B. Focus solely on lymphatic drainage techniques. C. Increase the duration of the massage session. D. Apply heat packs liberally throughout the session. Answer: A. Avoid deep pressure and vigorous techniques. This question assesses your knowledge of contraindications related to medication use, specifically anticoagulants, blood thinners. Anticoagulants reduce the blood's ability to clot, making clients more susceptible to bruising and internal bleeding. Therefore, it is critical to avoid deep pressure, strong friction, or vigorous techniques that could damage capillaries and lead to significant bruising or hematoma formation. Always inquire about medications during intake, as this crucial information directly influences the safety and efficacy of your massage application. Prioritizing gentle techniques for clients on blood thinners is a must to prevent adverse effects. Question 4. Which massage technique involves a rhythmic lifting, squeezing, and kneading of soft tissues? A. Effleurage. B. Petrissage. C. Tapotement. D. Friction. Answer: B. Petrissage. This question tests your understanding of fundamental massage techniques and their specific actions. Petrissage is characterized by rhythmic kneading, lifting, rolling, and squeezing movements, which are applied to muscles and subcutaneous tissue. This technique helps to milk metabolic waste out of tissues, increase circulation, and loosen adhesions, making it excellent for deeper muscle work. Recognizing the descriptive keywords lifting, squeezing, and kneading immediately points to petrissage. Mastering these distinct techniques allows a massage therapist to tailor their approach to different tissue needs and client goals. Question 5. A massage therapist is documenting a client's progress after several sessions for chronic low back pain. Which section of the SOAP note would contain objective measurements like range of motion and postural analysis findings? A. Subjective. B. Objective. C. Assessment. D. Plan. Answer: B. Objective. This question evaluates your understanding of SOAP note documentation, a critical skill for tracking client progress and communicating with other healthcare professionals. The objective section of a SOAP note is specifically for measurable, observable, and quantifiable findings that the therapist collects. This includes observations like postural imbalances, palpation findings, muscle testing results, and range of motion measurements. Accurate and thorough objective documentation provides concrete evidence of a client's physical state and helps demonstrate the efficacy of massage interventions. Remembering O for objective, O for observable can help you quickly recall this distinction. Question 6. A client reports experiencing persistent dull, aching pain in their shoulder that worsens with overhead activities and has noticed some swelling. This description is most indicative of which type of tissue pathology? A. Acute fracture. B. Chronic inflammation. C. Nerve impingement. D. Ligament tear. Answer: B. Chronic inflammation. This question tests your ability to recognize common signs of tissue pathology based on client symptoms. The keywords persistent dull, aching pain, worsens with activity, and swelling are classic indicators of inflammation that has become chronic. While other options might involve pain and swelling, a dull ache that persists and is aggravated by movement often suggests an ongoing inflammatory process within soft tissues, such as tendinitis or bursitis. Understanding these basic pathological signs helps massage therapists decide if massage is appropriate or if a medical referral is necessary before treatment. Question 7. What is the primary purpose of proper draping during a massage session? A. To keep the client warm. B. To protect the massage table. C. To ensure client modesty and comfort. D. To absorb excess massage lubricant. Answer: C. To ensure client modesty and comfort. This question focuses on a foundational aspect of professional massage practice, proper draping. While keeping the client warm and protecting the table are secondary benefits, the primary purpose of draping is to maintain the client's modesty and create a secure, comfortable environment. Professional draping builds trust, respects personal boundaries, and allows the client to relax knowing their privacy is protected. Always prioritize client comfort and dignity through meticulous and appropriate draping throughout the entire massage session. Question 8. Which of the following is a primary physiological benefit of effleurage? A. Increased muscle hypertrophy. B. Enhanced venous and lymphatic return. C. Reduction of joint dislocations. D. Stimulation of deep muscle spindle activity. Answer: B. Enhanced venous and lymphatic return. This question assesses your knowledge of the specific physiological effects of common massage techniques. Effleurage, characterized by long, gliding strokes, is primarily designed to warm the tissues, prepare them for deeper work, and, most importantly, enhance the flow of blood back to the heart, venous return, and lymph fluid. These strokes are typically performed towards the heart to assist the natural direction of fluid movement. Understanding this key benefit allows you to effectively use effleurage as an introductory and finishing stroke, promoting detoxification and reducing swelling. Question 9. When positioning a pregnant client in the side-lying position, what is the most important consideration for her comfort and safety? A. Place a bolster under her knees. B. Ensure pillows support her head, belly, and between her knees. C. Position her entirely flat on her back. D. Have her lie prone with a face cradle. Answer B. Ensure pillows support her head, belly, and between her knees. This question addresses safe and comfortable positioning for pregnant clients, a critical aspect of prenatal massage. For side lying, adequate pillow support is paramount to alleviate pressure on the lower back, hips, and abdomen, which can become strained during pregnancy. Supporting the head, belly, and placing a pillow between the knees helps align the spine and distribute weight evenly, enhancing comfort and preventing strain on ligaments. Proper cushioning demonstrates care and ensures the safety of both mother and baby. Question 10. The fibula is a bone located in which part of the body? A. Arm. B. Leg. C. Spine. D. Hand. Answer B. Leg. This question tests your basic anatomical knowledge of the skeletal system. The fibula is one of the two long bones located in the lower leg, running parallel to the tibia, which is the larger of the two. While the tibia bears most of the body's weight, the fibula provides stability to the ankle joint and serves as an attachment point for various muscles. Knowing the location of major bones is fundamental for accurate palpation and understanding muscle attachments during massage. Think of the fib and fibula as a hint that it's the skinnier bone in the lower leg. Question 11. A client has a localized acute inflammation, such as a recently sprained ankle, within 24 to 48 hours. Which of the following massage techniques is absolutely contraindicated directly on the affected area? A. Light effleurage proximal to the injury. B. Gentle compression distal to the injury. C. Deep friction directly on the sprained ligaments. D. Static compression hold away from the injury. Answer C. Deep friction directly on the sprained ligaments. This question emphasizes understanding contraindications, particularly for acute injuries. Acute inflammation is a stage of healing characterized by pain, swelling, heat, and redness. Applying deep friction directly to a recently sprained ligament would exacerbate the inflammation, increase pain, and potentially delay healing by causing further tissue damage. While gentle work around the area might be appropriate to reduce swelling, direct deep techniques on acute inflammation are always contraindicated. Always prioritize the client's healing process and avoid any techniques that could worsen an acute injury. Question 12. Which massage technique is best suited for breaking down adhesions and scar tissue in superficial tissues? A. Tapotement. B. Vibration. C. Friction. D. Petrissage. Answer C. Friction. This question focuses on selecting the appropriate massage technique for specific tissue conditions. Friction, characterized by deep, circular, or transverse movements applied to a localized area, is specifically designed to create therapeutic inflammation and break down adhesions, which are bands of scar tissue. This technique can help to realign collagen fibers and improve tissue mobility. The keywords adhesions and scar tissue are strong indicators that friction is the intended answer. Mastering friction techniques allows therapists to effectively address chronic tissue restrictions and improve range of motion. Question 13. A client begins to share very personal details about their relationship problems during a massage session. What is the most appropriate response from the massage therapist? A. Offer personal advice and opinions on their situation. B. Gently steer the conversation back to their physical well-being or a neutral topic. C. Share your own personal relationship struggles to make them feel comfortable. D. Ignore their comments and continue the massage in silence. Answer B. Gently steer the conversation back to their physical well-being or a neutral topic. This question assesses your understanding of professional boundaries and the therapist's role. While it's important to build rapport, a massage therapist's role is to provide therapeutic touch, not to act as a counselor or personal advisor. Engaging in personal discussions beyond the scope of practice can blur boundaries and create an unprofessional dynamic. Gently redirecting the conversation maintains a professional environment focused on the client's massage experience and physical needs. Remember that maintaining clear boundaries protects both the client and the therapist, ensuring a safe and therapeutic space. Question 14. What is the primary purpose of a thorough health history intake before a massage? A. To gather gossip about the client's personal life. B. To determine appropriate massage techniques and identify contraindications. C. To recommend dietary supplements to the client. D. To diagnose the client's medical conditions. Answer: B. To determine appropriate massage techniques and identify contraindications. This question highlights the critical importance of the health history intake process. The primary purpose of this initial assessment is to gather vital information about the client's medical conditions, injuries, medications, and health goals. This information is crucial for the massage therapist to determine which massage techniques are safe and beneficial, and, most importantly, to identify any contraindications that might make certain techniques or the entire massage inappropriate. A comprehensive intake ensures client safety and allows for a customized, effective treatment plan. Always remember, the intake protects both you and your client. Question 15. Edema, characterized by swelling due to fluid retention in tissues, is a common issue. Which massage technique is generally most beneficial for reducing mild, non-pitting edema? A. Deep tissue massage. B. Cross-fiber friction. C. Lymphatic drainage. D. Tapotement. Answer: C. Lymphatic drainage. This question focuses on choosing the most appropriate massage technique for a specific physiological condition. Edema is an accumulation of fluid, and lymphatic drainage, a gentle, rhythmic technique, is specifically designed to stimulate the lymphatic system. This system is responsible for removing excess fluid, waste products, and toxins from the interstitial spaces, effectively reducing swelling. While other techniques have their benefits, lymphatic drainage is the most direct and effective approach for managing edema, especially when it is mild and non-pitting, and not related to a systemic medical condition requiring physician clearance. Question 16. After a massage session, what is the most appropriate method for handling soiled linens? A. Leave them on the massage table for the next client. B. Place them directly into a regular trash can. C. Store them in an open hamper until laundry day. D. Place them in a designated, closed hamper for soiled linens. Answer: D. Place them in a designated, closed hamper for soiled linens. This question tests your knowledge of essential hygiene and sanitation practices in a massage therapy setting. Proper handling of soiled linens is crucial for preventing the spread of germs and maintaining a professional, sanitary environment. Placing them in a designated, closed hamper keeps contaminants contained and separates them from clean linens, reducing the risk of cross-contamination. Always prioritize strict hygiene protocols to protect yourself and your clients from potential infections. Question 17. The parasympathetic nervous system is primarily responsible for which of the following responses during a relaxing massage? A. Increased heart rate and blood pressure. B. Fight or flight response. C. Rest and digest response. D. Release of adrenaline. Answer: C. Rest and digest response. This question delves into the physiological effects of massage on the nervous system. The parasympathetic nervous system is a branch of the autonomic nervous system responsible for promoting relaxation, conserving energy, and facilitating bodily functions like digestion and rest. A relaxing massage stimulates this system, leading to a decrease in heart rate, blood pressure, and muscle tension, helping the client enter a state of calm. Understanding the rest and digest function of the parasympathetic system helps explain many of the profound relaxation benefits of massage. Question 18. When working with an elderly client, which of the following is the most important consideration? A. Always use the deepest pressure possible. B. Be mindful of fragile skin, potential osteoporosis, and reduced mobility. C. Sessions should always be at least 90 minutes long. D. Focus exclusively on vigorous deportment techniques. Answer: B. Be mindful of fragile skin, potential osteoporosis, and reduced mobility. This question addresses important modifications for working with special populations, specifically elderly clients. As individuals age, their skin often becomes thinner and more fragile, bones may be more brittle due to osteoporosis, and joints might have reduced range of motion. Therefore, using lighter pressure, avoiding vigorous techniques, and being extra gentle when positioning or moving limbs are crucial for their safety and comfort. Always tailor your approach to the specific needs and health status of each elderly client to prevent injury. Question 19. Which of the following joint types allows for the greatest range of motion, including flexion, extension, abduction, adduction, circumduction, and rotation? A. Hinge joint. B. Pivot joint. C. Ball and socket joint. D. Saddle joint. Answer: C. Ball and socket joint. This question assesses your knowledge of joint anatomy and their respective ranges of motion. A ball and socket joint, found in the shoulder and hip, consists of a rounded bone fitting into a cup-like depression. This structure allows for movement in multiple planes, providing the widest range of motion among all joint types. Understanding joint mechanics helps massage therapists recognize limitations and apply techniques effectively to improve mobility. The ability to perform all listed movements is a key characteristic of a ball and socket joint. Question 20. A client presents with a high fever, generalized body aches, and fatigue. What is the most appropriate action for the massage therapist? A. Perform a light, relaxing massage to help them feel better. B. Focus on specific pain areas only. C. Advise the client to reschedule and seek medical attention. D. Apply cold compresses to reduce the fever during the session. Answer: C. Advise the client to reschedule and seek medical attention. This question tests your knowledge of absolute systemic contraindications. Symptoms like a high fever, generalized body aches, and fatigue are strong indicators of an acute systemic infection, e.g., flu, severe cold. Massage would not only be uncomfortable for the client but could also potentially worsen their condition by increasing circulation of pathogens, or, importantly, risking transmission of the illness to the therapist or other clients. Always prioritize the client's health and the health of your practice by advising them to rest and seek medical advice, then rescheduling their appointment. Question 21. When performing deep tissue massage, what is the most important principle to ensure client comfort and effectiveness? A. Always use maximum pressure immediately. B. Work quickly through the muscle tissue. C. Apply sustained pressure gradually, allowing tissues to release. D. Maintain constant conversation to distract the client from discomfort. Answer: C. Apply sustained pressure gradually, allowing tissues to release. This question focuses on the proper application of deep tissue massage. Effective deep tissue work involves slow, sustained pressure that allows the underlying tissues to soften and release, rather than forcing through them. Applying pressure gradually and waiting for a therapeutic melt or release from the tissue respects the body's natural response and minimizes client discomfort, making the work more effective. Rushing or using excessive immediate pressure can cause guarding or pain, which defeats the purpose of deep tissue work. Always listen to the client's feedback and work within their comfort level, letting the tissue guide your depth. Question 22. A massage therapist discovers a client's highly sensitive personal information written on a loose piece of paper in the treatment room. What ethical principle is most directly violated if this information is not properly secured? A. Beneficence. B. Non-maleficence. C. Confidentiality. D. Autonomy. Answer: C. Confidentiality. This question highlights a core ethical principle in massage therapy: confidentiality. Confidentiality means protecting a client's private information, including health details and personal data, and ensuring it is not disclosed to unauthorized individuals or left exposed. Leaving sensitive information unsecured directly violates this principle, risking the client's privacy and trust. Maintaining strict confidentiality is paramount for building trust and adhering to professional standards, and any client information should always be securely stored or disposed of. Question 23. After a deep tissue massage session, a client reports feeling sore and slightly fatigued. What is the most appropriate post-massage self-care advice to provide? A. Engage in vigorous exercise immediately. B. Consume a large, heavy meal. C. Drink plenty of water and rest. D. Take a hot bath with Epsom salts right away. Answer: C. Drink plenty of water and rest. This question assesses your knowledge of appropriate post-massage self-care recommendations. After a deep tissue massage, it is common for clients to experience mild soreness as metabolic waste products are released and muscles adapt to the work. Drinking plenty of water helps flush these toxins from the system, while rest allows the body to integrate the work and heal. Encouraging proper hydration and rest supports the body's natural recovery process, optimizing the benefits of the massage. Question 24. The origin of a muscle refers to its attachment to the A. More movable bone. B. Less movable bone. C. Midpoint of the bone. D. Belly of the muscle. Answer: B. Less movable bone. This question tests a foundational concept in musculoskeletal anatomy: muscle origins and insertions. The origin of a muscle is generally defined as its attachment to the more stable or less movable bone or structure, typically closer to the midline of the body. In contrast, the insertion is on the more movable bone, which moves during muscle contraction. Understanding origins and insertions is essential for comprehending muscle actions and applying effective massage techniques. Always think of the origin as the fixed point from which the muscle pulls. Question 25. Which of the following scenarios falls outside the typical scope of practice for a licensed massage therapist? A. Providing a relaxation massage for stress relief. B. Performing lymphatic drainage to reduce post-surgical swelling, with doctor's consent. C. Diagnosing a client's back pain as a herniated disc. D. Applying heat therapy to a client's tense shoulders. Answer: C. Diagnosing a client's back pain as a herniated disc. This question directly addresses the crucial concept of scope of practice for massage therapists. Licensed massage therapists are trained to assess and treat soft tissue dysfunction through manual techniques, but they are explicitly not authorized to diagnose medical conditions, prescribe medication, or offer medical advice. Diagnosing a herniated disc, or any other medical condition, is the exclusive purview of medical doctors or other licensed healthcare providers with diagnostic training. Always remember to refer. Don't diagnose when a client presents with symptoms beyond your training.